So I'm with Christopher, who is experienced and familiar with the context of Nigeria, which is what we're talking about now. So Christopher, what's actually going on in Nigeria as far as COVID-19 is concerned?
Yes, absolutely. So when it comes to the case study of Nigeria, as of today, there's about 4,641 confirmed cases of COVID-19. And in terms of deaths, there have been 151 reported deaths. In Nigeria, one of the difficulties is the high population density. So issues relating to social distancing can be very difficult to implement in actuality. Now, up until recently, last week or within the last 2 weeks, the lockdown imposed by President Buhari on the Nigerian state has been eased. So businesses are allowed to be open, provided that they practice some sort of sanitation measures and encourage individuals coming in to engage in social distancing. There has been in metropolises such as Lagos a marked rise in individuals that are wearing masks. Face masks in public. However, in northern Nigeria, in Kano in particular, there's been an outbreak of COVID-19. And so that's one of the alarming developments that's gaining much attention when it comes to Nigeria and the COVID-19 pandemic.
So in Lagos, let's start there, a city of 30 million people. Most of us can't even imagine what 10 million looks like. How's it playing out in terms of the relationships on the ground? And is there a lot of fear or are people just getting on with their lives?
Yes. Well, I think that's an excellent question. And it's interesting when it comes to Lagos in particular. I think that highlighting the religious leaders is actually essential, because I was reading an article recently about how, yes, medical infrastructures and hospital facilities are testing to the extent that they can and trying to comfort individuals as much as possible. But in many ways, religious leaders are also doing their bit. They're promoting their own sermons that have to do with God protecting and the divine providence and things of that nature, which also brings up interesting considerations about the kind of juxtaposition of religion and science in Nigeria. I would say in Nigeria, there is a growing fear simply because the health care mechanisms, the infrastructure is not in place in Nigeria. It doesn't exist. I was reading recently that as a example, in Kano in the north, they have 3 testing centers. And one of those testing centers that was donated by, I believe, Aliko Dangote, Nigeria's wealthiest man, tests about 1,000 people a day. And you can think about that in the context of a place like Lagos. These medical testing infrastructures, they're not sufficient for a population of 30 million. Lagos as a city is bigger than many countries in the world. And so there is a growing fear. And I do think that over the next weeks and within the next month or two, we're going to see some crucial developments within the Nigerian and the African context when it comes to COVID-19 that I think the global health community needs to pay much more attention to.
Are there, I was going to say, do the ethnicities impact on this? Not just that, I'm thinking in terms of the tribal loyalties and the leadership. Presumably there is some excellence in the leadership or some disaster in the leadership, depending on the particular context. So what role do those tribal loyalties play in the way that Nigerians are leading their lives at the moment?
Yeah, so that's an excellent question as well. I was reading about how earlier, a few months ago, in Kano, in northern Nigeria, the traditional ruler, Muhammad Sanusi, was deposed. And one of the difficulties of that is that Muhammad Sanusi was actually more appreciated by the Christian community in Nigeria because he was viewed as more forward-thinking from their perspective. Now, he was very unpopular with Nigeria's political establishment, and that's one of the reasons that he became deposed. But that sort of tribal affiliation is particularly difficult now because there's widespread belief that if Sanusi was in power, that he would promote a COVID-19 response regime or a strategic program that would be much more of a solution when it comes to making positive differences. In Nigeria, their traditional rulers not only still exist, but in many instances, their word is life and death. They wield tremendous power, tremendous economic power. In northern Nigeria, which is predominantly Hausa and Fulani. That differs, of course, from Southwest Nigeria, which is Yoruba, and the East, which is Igbo. But I think that, when it comes to these ethnic and tribal affiliations, I think that's also very much intertwined with religion, because for a lot of religious communities, they look to their religious leaders, oftentimes who share their ethnic or tribal affiliation, for guidance in times of crisis, very much such as this.
And of course, Nigeria's had a history of crises, often in terms of
Mm-hmm.
internecine conflict between the different tribes, between the different religious communities. And there's always a danger that this can spring up again.
Mm-hmm. Absolutely. I think what's interesting, though, is the fact that COVID-19 is not a respecter of one's tribal affiliation. It affects all. There's been some very interesting articles in the BBC that have talked about how, from the perspective of the Nigerian poor, they view COVID-19 as a scourge against the rich, the elites, because in many ways, the virus has been brought into Nigeria by the affluent, the opulent of Nigerian society. Then in many ways, it's passed on through their servants, their attendants, what have you, and in that way, it filters down. But I think what's very interesting when it comes to COVID-19 is it actually very much has the potentiality to unite the population across tribal and ethnic lines, because COVID-19 doesn't care if you're Hausa, Igbo, or Yoruba.
Yes, it's interesting. I've heard that just in an earlier recording I did from Jerusalem, where there was a fear, and this was a Palestinian, Rami Dajani, who was talking about how he was worried at the beginning that the epidemic would be politicized by both the Israeli authorities, but the Palestinian leadership. But that didn't happen because there was a realization that a virus does not know boundaries, whether it's of ethnicity or nationality or gender or social economic factors. And he was thinking about, well, how might we continue this once it's passed? In other words, not just return to type in terms of the conflict of Israel-Palestine. And that's a sort of echo of what you've just said in terms of a coming together or a realization that we are in it together. Or am I being Pollyanna-ish?
Well, I think that there is this coming together because it must be so. Nigeria without a virus has enough political polarization and fragmenting. But with this virus, because of the low quality of medical and healthcare infrastructures in Nigeria, if this virus was to take off, I mean, tremendously take off, to the historical extent of, say, HIV or AIDS or what have you, it would absolutely ravage Nigerian society, particularly because it's, going back to the earlier point, it's a country with such a high population density. Nigeria geographically is about 1.5 times the size of the American state of Texas, but it has just over 200 million people. And so I think you are correct to highlight and underscore that coming together, because it's happening out of necessity. And I would also argue that contemporarily, oftentimes within Nigerian society, the different tribes, the different religions, they largely live at peace. It's whenever you have an election or whenever you have individuals that are campaigning for political and economic gain, that they stir up all sorts of interreligious tensions and manipulations that can be used for their respective benefits. But I do think that COVID-19 is promoting a sense of intertribal solidarity out of pure necessity.
Christopher Wadibia, thank you very much.